Gut Health with DrRKrishnanSriram, Consultant Colorectal and General Surgeon.
Hi everyone, I'm DrRKrishnanSriram, Consultant Colorectal and General Surgeon from Gleneagles Hospital, Kota, Kinabalu. And today we are back again to discuss another topic regarding our gut health. Yeah. So I'd like to take a few of a minutes to talk about a condition that many people aren't aware until sometimes they experience some symptoms, which is actually the diverticular disease. Yeah. So what exactly is a diverticular disease? It's actually a condition where small bulging pouches called diverticulums, they are formed in the lining of your digestive tract, and most commonly is actually in the colon. And let's just break down things a bit more further. And you see, when you look at these pouches, when these pouches form, we call them diverticulosis. Yeah. So if it's a single pouch, it's a diverticuli, but if they're multiple, then we call it a diverticulosis. So most of the time, people with diverticulosis don't even know they have this problem. Yeah, it's often symptom free, but in some cases, it can cause mild abdominal pain, discomfort, and bloating. What actually causes this? Yeah, so we look at the main culprit for this actually a low fiber diet and also aging. A diet that's lacking in fiber causes increased pressure in the colon, which can lead to the formation of these small pouches over time. And over time as well, the number of pouches can also increase. And now, here's where we can get a bit more serious. Diverticulitis is one of the complications that actually happens with diverticulosis. So this happens when those pouches become inflamed or infected. Yeah, it can cause more severe symptoms such as abdominal pain, fever, nausea, and so on. Yeah, even diverticulitis has got a spectrum, right from a very mild diverticulitis to the extent of a severe abscess in the abdomen. Yeah, so it's just a spectrum of the disease. In such cases, usually we confirm the diagnosis with imaging such as CT scan before we start treating them. Of course, with addition of blood tests and all those things as well. So when it comes to treatment, this is what you actually need to know. For diverticulosis, the goal is prevention. Yeah, we don't treat. You can't treat for diverticulosis. Yeah, the main reason is actually increase fibers in your intake, such as fruits, vegetables, grains, soluble fibers. So these are some of the excellent choices that we can have. Whereas for diverticulitis, it all, as I said, depends on the severity of the cases. Very mild diverticulitis, we can even get away without antibiotics, but a bit more serious, then you probably prescribe with antibiotics. And most severe and recurrent cases, sometimes surgery is something that we need to think of. Besides this, there are other complications related to diverticulitis, yeah, diverticulosis, such as perforation and abscess. This, as I said, is an other end of spectrum for diverticulitis. Yeah, these diverticulums also can bleed sometimes, and they can bleed very massively. And most of the time, these patients will be rushed into emergency because of massive rectal bleeding. Yeah, though most of the time this rectal bleeding stops by itself, but it can cause severe distress, severe hypotension for the patients. Yeah, a long-standing diverticulitis or recurrent diverticulitis, they tend to form an inflammatory mass, and this can cause a chronic pain to the patient. Yeah, there's no other way sometimes to relieve this except with the surgery taking out that inflammatory mass. Another rare complications of diverticulosis is actually fistulation. This also happens as sequelae from diverticulitis. One of the common sites the diverticulum fistulates is actually to the urinary bladder. What do I mean by fistulation? So it the two parts of the organs, they join together and they form a tunnel. So patients can have feces coming out through the urine, yeah, or when they pass urine, they can feel gas coming out as well. So there's a communication between the bowel and the urinary bladder. Again, the only way to settle this is by surgery. Again, would like to stress that prevention is really the key. By eating a rich diet in fiber, staying well hydrated, and keeping active with regular exercises, you can lower your risk and support a healthier colon. If you're experiencing any of these symptoms and just want to be proactive about your health, I strongly encourage you to speak to your doctors. Yeah, early awareness and lifestyle adjustments can go a long way. With that, take care of your diabetes, your health, and as always, stay healthy. Thank you very much.